There are several types of medications for dementia and Alzheimer's disease. There are medications specifically for dementia. These come in two types. The first is what are called cholinesterase inhibitors. These include Aricept, Exelon, and Razidine. The second class is what is known as an NMDA receptor antagonist. The only medication of this type is memantine, which is marketed in the United States as Namenda. We also think about medications that may slow down dementia. Vitamin E is an example of this. Many supplements claim to have positive effects on memory. However, the evidence whether they work is often scant. The other question we often neglect to ask is whether they can be harmful. There are concerns about megadoses of vitamins, especially the fat-soluble vitamins like vitamin A or vitamin D. Pyridoxine, vitamin B6, was thought to be a treatment for schizophrenia. However, when given in very high doses, it caused pain in the limbs. Vitamin E can also have side effects. If one takes an overdose of it, it may affect blood clotting. There are a number of controversies in the treatment of dementia with medications. The first is, should persons with non-Alzheimer's dementia receive these medications? It really depends upon the diagnosis. People with Parkinson's disease dementia or dementia with Lewy bodies share many chemical similarities with Alzheimer's disease in their brains, and the answer is yes. The answer is maybe for kinds of dementia such as vascular dementia or frontotemporal degeneration. The answer may be no in some cases. Dementia due to metabolic deficiencies, such as vitamin B12 deficiency, should not be treated like that. We should treat the underlying cause. Severe dementia may not respond to any of the known medications, and unusual dementias should probably not be treated with those medications. A much more important controversy is, should persons with behavioral disturbances, especially in Alzheimer's disease, receive medications? Why is this controversial? It is off-label usage. There are no FDA-approved treatments for the behavior in dementia. Serious side effects are possible. These can include things even up to sudden death. Other side effects include things like sedation, falls, drug interactions. The consequences of this could be very real. They may lead to nursing home placement, falls, and sedation. Nobody wants to see mom as a zombie. One should also consider whether medications are part of the solution or part of the problem. It is frequent that once a medication is given, that the behavior returns or maybe even worsens. Is the medication actually making the person worse? However, the underlying feeling is that there is a need to do something, but it has to be done carefully. I do have some suggestions for physicians and patients and families. The first is, what is making the person feel and act this way, and why now? A classic example of this is when the person says, "Take me home," when they are home. Let's try to see it from their perspective. Clearly, it is a failure of recognition. Families sometimes give them the tour of the house. Here's the living room, here's the bathroom. What more can you expect? One should also think, though, about what home means. Home means safety, security, warmth. One of the reasons they may want to be taken home is that they don't want to be where they are currently. They may have unmet bodily needs. They may be scared or anxious or lonely. It is a truism in medicine that quality of care is proportional to quality of assessment. Behavioral changes need to be taken seriously and on an individual basis. The closer you can get to defining the symptoms, the higher the likelihood that you're going to succeed. One should think about what symptoms are present. Is anxiety present? Is there hallucinations or paranoia or depression? How do these interact? We should also recognize that symptoms may occur in any combinations. We would like to ideally have a target symptom to monitor response versus side effects. The closer you are to defining the symptom, the higher the likelihood of a success. Lastly, non-pharmacologic approaches, such as maintaining social engagement, mindfulness meditation, and yoga, are clearly better than medications if they work, since there are no drug interactions and very few negative side effects. The biological basis for these may be intuitively obvious in some cases, such as better lighting in a nursing home or artistic and musical engagement, or more obscure, such as the positive effects of yoga. Overall, non-pharmacological interventions need to be judged fairly, both in terms of efficacy and expense.